Okay, welcome to those who have joined us already. I am Janine Wilson, the Chief Executive of the Eastern Melbourne PHN, and we're here today to provide a briefing session on the COVID Allied Health Package for allied health services in residential aged care facilities. If I can please start, thank you, team, with an acknowledgement. Today, I'm joining you from the lands of the Wurundjeri people and other people of the Kulin Nations, on whose unceded lands our work in the community takes place. And I know there'll be people from other lands on the call today. EMPHN respectfully acknowledges their ancestors and elders past, present and emerging. We recognise and value this knowledge and wisdom of people with lived experience, their supporters and the practitioners who work with them. We celebrate their strengths and resilience in facing the challenges associated with their recovery and acknowledge the important contribution that they make to the development and delivery of health and community services. Thank you. All right, just a few things about this session we're about to go into. So firstly, just to keep yourself on mute until you're ready to speak. There is no chat box tonight, but the team will be taking down questions as they arise. But do put the questions into the questions box there and press send. And you may have already noticed, but just to make sure that you do, this session is being recorded. And finally now, I think, on to an agenda. So I've just done a bit of a welcome there, first one. I'm hoping very shortly I can introduce Anne-Marie Boxall, the Commonwealth Chief Allied Health Officer, to give an overview of the design of the program. From there, we'll go into the PHN's approach to the program, and we're going to hear there from Sarah O'Leary from the Northwest Melbourne PHN. There was some time for some procurement FAQs, and Jason's joining us for that. And then a Q&A session and a close. Just noting also, for those of you who are not aware, given that the impact on residential aged care was so great and deep on the Metro Melbourne, this is why the 3 Metro PHNs have joined forces here, the one that I'm leading here at Eastern Melbourne, but also Northwest Melbourne and Southeast Melbourne. The teams have worked together to figure out an implementation approach here that applies the consistent vision of the Commonwealth and also looks for, easier and better ways of doing things. So that's a nice way to start. I'm going to ask now if we have Anne-Marie yet. And I'm thinking maybe not. That might be okay. We might actually, just in the interest of time, I'd love to hear from Anne-Marie, and I'm hoping she'll join us soon. Can I suggest, Sarah, that we launch into the approach to the program? And like, it's a little bit cart before horse perhaps, but I'm sure we'll all catch up.
Absolutely.
If you're happy to give us the approach to the program, and when we know that Anne-Marie has joined us, we can welcome her and maybe segue back to the overview of the actual program design. Is that all right?
Yes, absolutely. Sure, Janine. Thank you. So over to me. Hi, everyone. My name is Sarah O'Leary. I'm the Director of Integrated Care at Northwestern Melbourne PHN, and I'm just going to take you through over the next few slides a bit of an overview of what we are commissioning and the approach we are taking. As Janine mentioned, we are attempting to take a consistent approach to make it easier for providers to apply for this commissioning activity. So a bit of an overview of what we are commissioning. The PHNs are commissioning a program to deliver allied health services into residential aged care facilities in our regions that were affected by COVID-19 outbreaks. Included in this commissioning approach is the commissioning of physiotherapists, exercise physiologists, and occupational therapists to provide a group therapy program to residents in residential aged care facilities. The Australian Department of Health has determined that facilities with 2 or more cases of COVID-19 are eligible to take part in this program. And the Metro Melbourne PHNs collectively have the highest number of facilities in our region. So it's really important to us that we take a consistent approach to how we undertake this commissioning, and we've worked really hard to do that and to make this as straightforward a process for everyone, hopefully on the call tonight. So if you can move to the next slide, please. I guess I'll probably maybe just skip to the next slide, because a lot of that detail on that slide probably requires a little bit of an intro from Anne-Marie, and I might move to who are we commissioning? So who are we seeking applications from? And in this activity, we're really hoping to hear from allied health providers who can demonstrate capacity and capability to implement the prescribed physical therapy program in eligible residential aged care facilities. We have notified facilities in our region that this program is taking place and that they are eligible, but unfortunately we're unable to provide funding to facilities to engage in this program. So it's probably important to note that there. Can I just jump in and ask, is Anne-Marie on the call? Is that what I'm seeing? Or is that someone else? Apologies, I'll keep going. And if we could move to the next slide. How are we commissioning this process? So we're taking a whole of market approach to commission providers, and we've developed a set evaluation. Sorry, previous slide. Thank you. We've developed a set evaluation criteria that will be used as consistently as possible across the 3 PHNs. Each PHN will be individually commissioning services. So we're expecting applications from across the region. So providers will need to submit an application to each relevant PHN which they're seeking to contract with. So the next slide. So we're hoping that everybody has already seen the notifications regarding this commissioning activity, and that there is sufficient time for people to submit within the closing times outlined. Each PHN will evaluate the applications and approach successful providers for contracting. And we're expecting this program to run to begin or commence delivery in late June. And it's a 26-week program, which will finish or terminate at the end of December. And that is related to the, I guess the rationale for that time frame is really around the time required to support patients who are at risk of deconditioning. So it is a time-sensitive commissioning activity. And I think that was it for me in terms of an overview. And I'm hoping that Janine is on the line. If not, I'll hand back to Narelle.
No, that's okay, Sarah. I am here. Unfortunately, I'm going to have to check in with Charlene to see whether or not we have managed to reach Anne-Marie.
Sorry, I'm actually on hold. They are trying to access right now. They're just having some difficulties joining us. So if you just bear with us for a couple of minutes, and we'll try and make sure we understand what the problem is. They've got the correct link, just some technical difficulties, might be a firewall coming in from the department in Canberra. So just bear with us a minute or two, and hopefully that will pay dividends. Thanks.
All right. So, Sarah, thank you so much for your overview on how much we've actually conceptualised of the program here at the Eastern Melbourne PHN. I suggest that we are going to continue to put the cart before the horse and perhaps move on to Jason, who will talk about some of the practicalities and pragmatics around how in which you actually participate in the tender opportunity that is currently live. And then we will wind back to, hopefully, Anne-Marie, who will actually talk about the overall conceptual concept behind the project. Jason, do you mind perhaps going through the procurement FAQs?
Absolutely. Thanks, Jamila.
And introducing myself, sorry. Yeah.
Yep. Thanks, everybody, for setting aside the time to attend this briefing. I'll be going through some of the procurement sort of action, like on-the-ground action required. So can we go to the next slide and the next slide? I'm Jason from EMPHN. So we'll have similar sort of comments applicable to the other PHNs as well. Sometimes we'll talk about a particular platform that we use, but I think you'll find that there's similar advice that applies to the other platforms as well. So I'm going to cover some of the submission tips in relation to using a tender platform. The terminology is used generally in the procurement space and some communication protocols, confidentiality in the Q&As asked, and conditions of participation, which is applicable to all PHNs as well. Next slide. Shamila, can I have? Okay, great. So we use eProcure at EMPHN at Northwest Melbourne, then use TenderLink. Essentially, it's a online platform to view and submit your applications. So everything's pretty much electronic these days. That way it's secure and things don't get lost in the mail, and it's much faster. But having said that, being an electronic system, we always have problems inevitably when we're coming to the time to uploading it, you know, whether it's internet connections failing, you've forgotten your password for your profile, uploads not being accepted for whatever technical reasons, such as illegal file names, pathways that you've stored your file is too long, or you've got some sort of, you know, invalid file name characters, or corrupt file, or whatever. So just, I guess the first pointer is to give yourself ample time. You know, don't leave it to the last 15-30 minutes. Give yourself 2 hours, preferably half a day even. It just depends on what problems that you face, and we come across a lot over the years. So one big lesson is to give yourself a lot of time to submit your application. At eProcure, they've got a helpline, a variety of ways to seek help if you've got problems, technical problems. They've got their 1-800 number, which is on the slide. They've also got an online chat function on their webpage, as well as an email. So the sooner you familiarize yourself around the platform and the features, the better.
Hello,
in the meantime,
it's Anne-Marie here. Can anyone hear me?
Oh, we're very happy.
We certainly can.
Thank goodness. Apologies for interrupting, and apologies, we've had enormous trouble getting on, but carry on. I'm here and I can talk, so it's all great now. Thank you.
all right.
Wonderful. Thanks, Anne-Marie.
To segue back to the beginning, is that too much of an introduction for you, Jason, or do you want to finish this section?
No, not at all. I'm happy to, this section has got a few highlights, but there's a whole lot of talking, so I'm happy for Anne-Marie to sort of provide us with the overview of about the program from a Commonwealth perspective, and then I'll resume.
Fantastic. So Anne-Marie, it's Janine Wilson speaking, the Chief Executive at Eastern Melbourne PHN. Thank you so much for joining us. We are big fans of the program that we know that yourself and your team designed in response to a really significant issue in terms of deconditioning in residential aged care during the Melbourne lockdown in particular, but everything around COVID. So I wanted to introduce you and give you the opportunity to provide this audience an overview of the design, the origins of it, and your expectations as the Commonwealth about the benefits of this program.
Excellent. Look, thank you very much. And I apologise that we weren't able to get through on Zoom. We tried a number of devices and apologies that I'm late and this is a little bit disruptive, but we've overcome our technological limitations, and at least I can speak with you. So thank you for the introduction. So what I'll do is just provide you with a summary of the program, some of the overview or some of the requirements of the group therapy, and keen to, as you mentioned, talk to you a little bit about the rationale for it as well, because we do see this as a really important opportunity for allied health in, I guess, demonstrating the value of allied health in RACF, because it's probably no surprise to many of you that it is not universally acknowledged or agreed that providing allied health to people living in RACF is beneficial. So we're really excited about this because we think this gives us a great opportunity to provide some evidence, some more evidence that it is a really beneficial approach for many people living in RACF. So that's kind of the context. So look, the opportunity came about, it's obviously a COVID measure, it's a temporary measure, and there was an acknowledgement from the government that many people living in RACF who had been in lockdown for a prolonged period of time, and that is obviously primarily in Victoria, they did suffer deconditioning as a result of that. And this is an attempt to try and boost the availability of allied health services to those people in RACF. It's complemented by some changes to the MBS, which will also help people who have deconditioned, who are living in RACF. But this one it's for all people living in RACF. So you don't need to have a chronic disease to be eligible. So you could have been in a RACF, be highly mobile, but actually deconditioned because lockdown has meant that you haven't been able to access your usual therapies or your usual activities, going out and things like that. So that's the rationale for it. What we've done is we have worked very closely with an academic expert who she actually did her PhD on this topic, looking at group therapy for elderly people in RACF. And it's very strongly based on a program called the Sunbeam program. And in her research, her name is Jennifer Hewitt, she has demonstrated through randomised controlled trials that this program is effective in preventing falls in the elderly. So we're trying to take this opportunity to expand the program and collect evidence so that we can demonstrate that a highly structured program for people in RACF is beneficial. So that's where it's come from. The funding that has been provided from the Department of Health here in Canberra to PHNs is for a range of things. One of them is an initial meeting with the RACF to discuss the program. So we understand this is new and there'll be some work involved to try and work out how an allied health professional will deliver this program in the RACF. It also provides funding for face-to-face consultation for each potential participant. Not all participants will be willing and not all participants will be able, but we want to give the opportunity for all participants to at least be assessed for their suitability for the program. And the funding also provides for 2 hours of face-to-face group therapy for each participant, and that's per week, and it's over a 26-week period, so a 6-month program. So we're thinking that is a pretty good opportunity for many people to improve their conditioning. One of the requirements for the program is that the group therapy needs to be led by either a physio, an OT, or an exercise physiologist. It does allow for those allied health professionals to use allied health assistants, students, or even staff from the RACF if they want to assist, but the health professional needs to be there in attendance at those group therapy sessions. The other requirement is that the sessions need to be on non-consecutive days. So, and that's just to make sure that the participants have an opportunity to rest and recover in between. And there's also a requirement that groups cannot be larger than 4 participants. And that's because recognising that these people often have high needs and that they need some fairly intensive support. So 4 people as maximum for a group. The program that is evidence-based is, as I mentioned, it's called the Sunbeam program, and the material provided to allied health professionals wanting to do this program is quite detailed, it's quite prescriptive, and the reason for that is because there is evidence that it works. But in the broad, the program involves resistance training, and that's progressively increased as the participant improves over time. it also includes balance work, and again, progressively scaled up in difficulty over time as the participants improve. We also have some funding to evaluate this program. So we are really very hopeful that the allied health professionals that will be delivering this program will be able to collect some baseline measurements on participants and also some concluding measurements on participants. And that information, or the average scores, will be able to be provided to PHNs. So we'll have a really rich source of data with which to evaluate this program at the end of the 6 months. There's been some questions about whether the exercise program can be modified, and that is yes, it can, but you know, you always need to have clinical autonomy and exercise clinical judgment, but also recognising that we are trying to implement an evidence-based program. So modified within the program that we are prescribing, not doing something entirely different. That's the aim that we're looking for. That's the outcome that we're looking for there. So just some slightly broader issues. So it's eligible PHNs are only those where there has been a residential aged care facility that has gone into lockdown. There are 11 across the country. Obviously, we're talking to the Victorian ones now, and we're hoping to gather data from all of those 11 PHN regions to feed into our evaluation at the end. So I'll pause there and I'll leave it back to you whether you want to ask questions now or whether you want me to take those at the end. So I'll pause and back to you, Jenny.
Thank you very much, Anne-Marie. That was really informative and hopefully gives people an idea of some of the genesis of the program and how much it has come to be in the shape and structure that it has, because there certainly is some fairly clear guidelines and guidance and based on very sound best practice and academic research there. Shamila, we might continue on with Jason, and then I do believe that we have some questions already up in the Q&A, plus also some particular questions that we might be able to ask of Anne-Marie. Is that correct? Are you happy to do that, Shamila?
Yeah, it should be.
Thank you. So Jason, you were, yep, lovely. Thank
Great.
you.
Thank you. So as I was saying, in terms of, you know, dealing with electronics platforms, it's a problem, as we've got a demonstration just then, and it's always good to give ourselves a lot of time in case of these issues. I was about to start on just talking about the eProcure tendering platform that EMPHN uses, and I'm notified that Northwest has a different platform called TenderLink as well. So I'm sure Brooke will chime in later on if she needs to highlight any differences or add further information. With eProcure, that's a tool that allows suppliers to register and view the opportunity, as many of you have already, and for the infant catchment area, and it is not yet. Thank you, Shamila. It allows you to indicate that you intend to respond or withdraw from tender, so that gives us visibility and no one else, I might add. And also in terms of, you know, hopefully you don't, but if for whatever reason decide to withdraw from the tender, you can select that so that you don't get updates later on. Now, registering also allows you to get additional information that sometimes happens in the course of a tender being run. That includes questions and responses to questions that the PHN supplies to everybody in a genericized, sort of scrubbed way to ensure anonymity and confidentiality is still there. We also sometimes issue out amendments to the opportunity because, you know, for whatever reason we might need to provide more clarity or change documents. So these are addenda or extend dates or whatnot. These are addendums that are issued through the platform, and it provides a tender closing reminders as well. So it's really good to register ahead so that you get these reminders to help stay on track. And of course, it's a platform that we use for suppliers to respond online and for us at the PHN to evaluate online. So it's very e-paper, like everything's electronic. So when you go into eProcure, you'll find that you actually have the ability to preview the online form that you provide your submissions in. So you're able to actually download the whole questions and print it off, share it with your various teams to get a response, and then go online and submit the information via the website or the platform. So it's very useful in that way. Once you've completed it, you can download a copy of the form of your submission, and you'll also get an acknowledgement of receipt of your submission as well. What's important here is to check your junk mail or your spam mail. Sometimes that gets blocked by everybody's email applications. So if you don't get a acknowledgement of a submission form, check that folder first. Now, as I said, IT is great when it works, but it's a pain when it doesn't. And what we recommend to make it work in terms of system requirements is to use a browser, to use Google Chrome as a browser. It will work with other browsers, but Google Chrome is the browser that this program is optimized towards. Do not use special characters in your file. So if you're uploading documents, such as your insurance certificate of currency for insurance and whatnot, do not name them as with special characters. So those are question marks, backslash, dollar signs, hashtags, etc. Just use normal alphabets and numbers. The files that you can upload, it's pretty broad, but generally, all your Word documents, Excel, PowerPoint, PDF, and texts, the files that it will accept. In terms of graphics, JPEG is the extension that is probably easiest and most non-troublesome. And the file size, you can go up to 100 megabytes, but if it goes over, you can zip your files and then upload that zip. So it accepts zip files as well. Can we go to the next page? Next slide. So I just wanted to share with the attendees some terminologies used, and this is sort of generally that's, I guess it's sort of from EMPHN's point of view, but I'm sure other PHNs will agree as well. You'll hear we're calling this as an expression of interest. The other PHNs might call this a request for tender or request for quotes. So they're effectively just a general label to indicate an opportunity. Those sort of titles indicate some degree of details and that's provided in detail that's intended in the contract, but it's not definitive. So generally, they're not exactly interchangeable, but they broadly mean opportunities for responding to an invitation from the PHN. What's important is identifying what are mandatory requirements. So in the specification itself, we highlight specifically what requirements are mandatory as opposed to optional. And mandatory requirements refers to the capabilities or information that must be met or provided by a supplier. And it's important because in the procurement space, if a supplier doesn't meet the mandatory requirements or provide the information required, that's going to be a deal breaker. And it's very hard to get back from that. So if you don't meet the mandatory, you do not comply with the requirements, and your response will not be accepted. So I can't emphasize enough to pay attention to what's mandatory in the specification. In our tender, it's in our EOI, it's listed on page 11 as mandatory requirements. So have a look in detail to that. I have to highlight that our eProcure tendering system also uses the same language, mandatory, but that relates to mandatory from an IT perspective, data entry. You have to enter that information as opposed to a program requirement. So just be mindful of that distinction. And apologies for any confusion that it leads, unfortunately, just different industries using the same language. Closing time, pay close attention to the closing time as well, not just the closing date. So the reason why we're using closing time is because, especially in an IT environment, once that closing time ticks over, you cannot submit your response anymore. Once again, important to provide a lot of time for yourself to upload. And this in procurement, this is pretty strictly enforced because of the conditions of participations and the general, which I'll go into detail later on, and the general principles of being fair to everybody. We don't have much scope to accept late submissions unless there is some exceptional circumstances to override that.
Jason,
Some other.
I'm just going to
Sorry.
give you a 5-minute warning. Okay.
Okay, great. Thank you for that. Some other general terms used. Addenda, you'll see, is us providing additional information from the PHN perspective. Questions, suppliers may ask questions to seek clarifications, and that's done via eProcure or in this forum, like in briefings. And of course, responses will be provided to all through the Q&A feature and addendum feature of the platforms. Next slide. Okay, so I just wanted to touch on questions. Have I just skipped? Okay. So on the communication protocols and questions. So one of the key principles in procurement is to be fair and open whilst conducting a tender. This means that everybody has the same information and afforded the same opportunities. Likewise, everybody's required to follow the same rules. Using a single communication platform is the way we ensure it here at EMPHN, and I'm sure other PHNs have the same protocols as well. And I guess we just wanted to stress that you are able to ask questions and receive responses, but please do so via the endorsed way, which is in the eProcure platform and in this forum in the market briefing. So your questions will be responded to in a general way, and in that regard, I mean, we won't disclose who it is, and we might rephrase your question to be asked in a general way so that your confidentiality is protected as much as possible. As we always hear, there are no such thing as dumb questions. If you've got a question, then it's likely that others will have it as well. So feel free to ask away. Make sure you have a read of the other questions already, though, so that we're not receiving duplicate questions. But yeah, there's no such thing as a dumb question. And yes, this information and these slides will be uploaded onto our platform so that everyone else gets it as well. Next slide, please, Shamila. All right, conditions of participation. Very important to have a read through the conditions of participation, because just like a contract, when you have it finalized and signed, a procurement process is a sort of process contract that you enter into and that we enter into, so that so that we all know what the rules are governing this process. So confidentiality is a condition that's afforded to all suppliers. Confidentiality in terms of your questions, confidentiality in terms of your submission. So don't feel confined or restrained about that. The submission is valid for 30 days, so that's just the offer validity period. So when you're doing your pricing or when you're doing your submissions, just be aware that there will be some time delay, and you should factor in a valid period of 30 days. That gives us time to evaluate your submission and to assess the pricing and whatnot. So before it lapses. Conflict of interest must be identified and declared if it's applicable. It's just a standard requirement, and all communication must be directed via the eProcure platform or the nominated platform of the respective PHN. Next slide. Now, this is just specific for EMPHN, so I just wanted to touch on it. If anybody has a specific question about it, then feel free to reach out through the eProcure system. But we have, as part of your response, a set of attachments that we'd like suppliers to complete so that we can adequately assess your proposal. And those attachments are, if you have subcontractors, then please provide their details in attachment 1. We'd like to know about the risk profile of you as a respondent, and that's provided in attachment 2. So if there's any legal proceedings, etc. We ask for referees details. So if it's deemed necessary or appropriate, we can contact referees to contribute to the assessment of your submission. If we do decide that, then you will be advised beforehand, so that there's no surprise. But the details are asked up front at attachment 3, and then we ask that suppliers review the proposed draft contract, and if there are any changes that needs to be made or requested of, then those details should be provided in attachment 4 as part of your submission. That way we can expedite that process by identifying what's what are at issue and then having that discussion as soon as possible. All right, that's all I've got, Shamila. On to the question and answers. Thank you for that.
Sorry.
Thank you very much there, Jason. Yep, yes.
Oh, sorry. I thought perhaps maybe I should just give some specific information about the tendering system that we use at Northwest Melbourne PHN. But basically, they're very, very similar.
Yeah, there's a...
Do we have time? I could be 30 seconds.
Yes, no. I was just about to ask Sarah and Brooke if you would like and to give us an update basically on TenderLink and the SEMPHN system as well. Thank you.
Yeah, that's okay. So basically most of the information Jason gave is very, very similar. So as he mentioned before, we use an online portal called TenderLink for the publishing and submission of tenders. To respond to our opportunity, you do need to be registered in order to respond. And there's information on the TenderLink website about how you can go about doing that. Also, just in relation to the last slide that Jason went through in relation to the additional information that needs to be attached for our particular tender, in addition to the responses to the mandatory and other evaluation criteria, there's just 2 other things that you need to attach, which is included in our online submission form, which is part E of our EOI pack, and that is just the contract departures template, which I believe is schedule 3, sorry, and also the part F declaration, and that's basically, I suppose, the main differences there.
Thank you, Brooke. And do I have anyone from SEMPHN regarding the name of your portal? No, okay, lovely. That information I'm sure would be readily available on the information that's gone out about this tender opportunity and also on the SEMPHN website. So moving along, we do have quite a number of questions, and there's some juicy questions, and we also do still have Anne-Marie on the phone and an opportunity to ask questions of Anne-Marie as well. Sorry, I did mistakenly close one of the questions, but someone helpfully put up the same question again. So the question I'm going to ask you is of our panelists, that we've indicated this is a 26-week program, and that is the design that's come from Anne-Marie's team at the department. Do we have an expected amount of specific weeks for the exercise, and also is there a pre-program assessment time and also a wrapping up and reporting time? So is the exercise program and all the assessment and wrap up fitted in the 26 weeks, or are they either side of the 26 weeks?
Do you want me to answer that? It's Anne-Marie here.
Thank you, Anne-Marie.
Yep. So our anticipation is that the therapy is for up to 26 weeks. So 26 weeks would be ideal. And so if the assessment time can precede that, that would be fantastic.
Thank you very much. And we will, and I'm speaking on behalf of the team here, unless Sarah or Shamila would like to speak in. Usually when we enter into these agreements, we'll have a program period, but also a contract period. And that contract period also allows time for us to have reports submitted and followed up. I think the assessment period will fit into the program period, but that reporting period will be post the time in which all the sort of direct service delivery activity will cease, and you'll be submitting your final reports, invoices, audited acquittals, things like that. If anyone else in the team wanted to add on to that one?
Don't know, Real, thank you.
Jason, you're still on mute.
Can you hear me?
Yes.
Nothing to add except that, yeah, that describes perfectly how we do it.
Excellent, thank you very much. We have a couple of questions from Amanda. I'll ask the first one. Can these sessions be delivered online?
So it's Anne-Marie here. No, they are required to be face-to-face.
Thanks very much, Anne-Marie. Also a question about session sizes. So I might put this to you again, Anne-Marie. Can the groups be smaller, e.g. 1 or 2 participants if a particular group of residents have specific barriers preventing them in being involved in larger groups? Is this clinical decision, or should this be justified to the PHN or DOE in their reporting?
Look, absolutely. So we have a maximum participation of 4, but if if a clinician thinks that it's better to run a smaller group, then we don't have any, we don't have any views on that. So I mean, obviously, patient safety is priority 1. So if you don't think it's safe to have a group of 4, then that is perfectly fine. So clinical decision making is absolutely important.
Yeah, I would tack on the end of that I think we would like this reported to the PHN and then back to the department, because we would like to know around the group size and makeup in your reporting, but that would form part of the reporting. And obviously group size does impact on the finances and the budget, so it would be included in the budget. Any further? Yep.
I'll just add one more thing to that as well. Yeah, so thank you. That is important, and that is valuable information for us as well. If we're able to get funding for this as a program ongoing, that information is really useful. The other piece of information is when the Sunbeam program was implemented, they had larger groups than that. So I expect there'll be variability, but yes, if they're smaller than 4, we'd really welcome that information.
Amanda, you've asked for clarification. The list of residential aged care facilities per PHN catchment is defined by 2 or more positive cases, and yes, that is correct. Also, another question, are we able to tender for program delivery in other PHNs and other facilities outside of the area facilities that we currently provide services to? I might put this one through to Sarah or Shamila or Charlene.
Sure. I can jump in, and feel free to jump in, Charlene or Shamila. I think if there are other opportunities outside of our region that are in Victoria, yes. I mean, there's nothing stopping providers from doing that. I think what's important for us is being able to demonstrate capacity and capability to undertake that, and being able to demonstrate that through your application to each of the PHNs. Anything to add there, or?
I was just going to say, and just remembering that if you are going across regions, that you need to send separate applications to each PHN.
Thank you, Shamila. Thank you, Sarah. And another question, will we be billing by numbers of groups or by practitioner hours? I might put this to Sarah, Shamila or Charlene again.
Yeah, so I'm happy to start. We're basing it on number of sessions, as Anne-Marie outlined. So we will be basing it on number of sessions per week per facility for that particular practitioner. So it will be on those number of sessions that we'll be basing it on, not necessarily on practitioner hours, although we do have a funding model that will help us with that.
Thank you, Charlene. I think, oh, no, one more question. What is most relevant in the pricing schedule submission? Is the unit rate most important? The total price revenue estimation as based on a number of assumptions, like number of residential aged care facilities, how many are assessed, how many are eligible? These assumptions will naturally vary across different applications. Well, the question there is, what is the most relevant in the pricing submission? Is it the unit rate most important for delivering those sessions?
I can shed some light on that one, Narelle. So whilst they're connected, the overall pricing of the submission based on your assumptions will be the primary driver for us at EMPHN. Obviously the assumptions need to be reasonable, but you know, we look at the pricing of a submission on a holistic whole of life contract basis. So the total pricing / revenue estimation is the primary driver for us.
And that is for assessing the pricing schedule submission, not the overall submission, but for the pricing schedule section. Yeah.
I think it's just really important.
Thank you very much, Jason.
Narelle, I think it's just really important to add there as well, to reflect back on what we've already said and what we're already aware of from the previous programme, that all residents will not be eligible for a variety of reasons to undertake the programme. So it is for the allied health professionals to get in there, work with the residential aged care facility and assess those residents. It will be a crucial first part of this programme to undertake that assessment and then understand how many residents in each of those residential aged care facilities will then be able to be part of those group therapy sessions. So that is an unknown quantity just now until we actually get in there and start the programme. But that also will have an impact obviously then on the total price going forward. So that's the part that we can't really look into or confirm before we actually get in and start working with the residential aged care facilities.
Thank you. This next question, I'm just flagging that I'm not sure that we can assess this question or answer this question right now. We may need to take it on notice and give you a response later. And all of these answers and questions, I'm assuming, are going to be available as part of the question and answers on our tender page. If there is any funding left over that's been paid out to the provider, but wasn't used in delivering the sessions because not all residents were eligible, can this be leftover funding be used to better the RSF environment, e.g. for equipment or resources? It seems a waste for the funding to remain unused. I'm just considering that we might need to provide some more detailed responses to this later, because there are restrictions on what the PHNs can fund when it comes to purchase of equipment, things like that. So if you don't mind, we might agree to submit an answer to this question later, because it is a very important question around the use of unspent funds and whether or not that would be recouped or used for another purpose, but also there are restrictions on what PHNs can purchase. The final question is a question regarding the design of the program, and I might put this one through to Anne-Marie. We've got a question saying that they believe these patients, or it's a comment really, need a holistic approach and should include a CDE. I'm not actually sure what the CDE reference is. One of my other colleagues might be aware, unless it's credentialed diabetes educator.
That's the only acronym I know for CDE, but I'm probably that's because I come from the diabetes space. Yeah, I don't know.
So it's Anne-Marie. I don't know what CDE stands for as well, but I'll assume the question means that these people are likely to need therapy other than physical therapies. And I would agree with that. There are, however, other mechanisms for these people to access those services. So, for example, the MBS items, so if a patient has a chronic disease, they are able to access an increased number of allied health sessions through that. So that's a complementary measure. So this program, it is restricted just to those physical therapies that I mentioned before, OT, physio and exercise physiology, but we have done something complementary so that they are able to access additional allied health therapies.
Thank you very much. I've got a couple of other questions regarding funding, so that's fine. We'll take those questions offline and answer them outside of this environment, but thank you very much for that. It is really important in this tendering environment that we do answer questions appropriately. So sometimes I will say we're going to take that one on notice and get back to you in writing. Sorry, I'll just, maybe I've lost my place in questions.
So we do have another couple. Narelle, I'm happy
yes.
to read the next couple out while you look
for
those.
Thank you.
Will PHNs be assigning successful respondents to specific RACFs if unable to service all facilities? Who would like to have a go at that one?
I can have a go on that one, I think, and you can add in any other details if I've missed it out or I'm completely wrong. So in your submission, you'll be able to identify which facilities you want to provide service to. Now, the assumption that we're going to make is that each of the location will be independent, so that if you're not awarded all of the facilities, that you'll still continue on with providing willingness to provide the service to each of the individual facilities. If that is not the case, please clearly indicate the basis upon which you're submitting. So if you've got we have to have at least 4 facilities to make the commercials work for us, highlight that so that we know what those conditions are. Otherwise, the assumption is that the facilities that you've submitted, that you've expressed an interest in, you're willing to do one or all or in between.
Thank you very much, Jason. The next question is, do the sessions have to be an hour? The questioner is asking, we currently have residents here that can only complete approximately 30 to 45 minutes of exercise at one time. We might put that question to Anne-Marie about the intention of the program.
Yeah, so look, the idea is that they receive 2 hours of face-to-face group therapy and over a minimum of 2 sessions. So if it requires 3, then that's, I guess, a matter of clinical judgment. But certainly, yeah, the idea is 2 hours in total. But not one session of 2 hours. So we're happy to go the other way. I mean, obviously, I don't think anyone would see that as feasible anyway. But yes, happy to go. Right. More sessions for a shorter period of time, but not one session for a longer period of time.
Okay, I've already indicated that we will consider the use of funds question outside of this, and so we're happy to answer those questions outside of this. I think that we've perhaps got to the end of the question list here, and we are at 6:26 p.m. So unless there are any other questions there, I might just ask you a question, Anne-Marie, a couple of little veriphysics questions that we had prepared in advance. Will there be a clear set of criteria by which to assess the eligibility of aged care residents?
So no, we are leaving that to clinical judgment. However, we have engaged Dr. Jenny Hewitt, who is the physiotherapist who designed and implemented this program, and she will be hosting a webinar soon that will be recorded so that that will provide a lot more information. She's also preparing some videos and some information. So there will be a lot of additional material that allied health professionals can draw on in addition to their clinical judgment.
Thank you very much, Anne-Marie. And another question was, will there be opportunities to adapt and expand the services to eligible residents who may not be able to complete the prescribed format?
So yes, so we recognise that, you know, to do your job properly, you need to have clinical autonomy and make clinical decisions. But we, as I mentioned before, very much adapting the program as opposed to replacing it with something else.
Great, thank you. And Anne-Marie, some of the questions we've received prior to going out to tender has been noted by some of the providers that providing an incentive to residential aged care facilities to engage in the program might help to ensure that the program could go ahead successfully. And this would account for the impact on residential aged care management and staff in being able to facilitate the program rolling out in their facility and enable the allied health providers to do that. Is there any consideration of allowing a small amount of funds to be available to residential aged care facilities to support the implementation?
So look, no, because we didn't receive any money through our budget processes specifically for RACFs to participate. However, I would note that RACFs have received funding, COVID funding, through a range of other sources as well. So whilst it's not specifically for this measure, there has been a support provided to RACFs in relation to COVID. So I think that hopefully that will be enough for them to incentivise them to participate, in addition to, of course, the fact that, you know, providing their residents with more therapy and that will improve their conditioning will also have benefits to the RACF as well.
Thanks very much, Anne-Marie. I'm just now going to defer to the rest of the program team to see whether or not there are any further questions.
I just want to add a few.
We had a couple of questions answered directly in the chat. Yep.
Meryl, I just wanted to add a couple of final notes for attendees. Please make sure that you observe the closing time for EMPHN, and for Northwest it is now the 3rd of May 2021 at 9 a.m. So we've pretty much extended it to give suppliers the weekend to do that, to finalize their submission and press the submit button. And also, whilst we would like everything to be included in this submission, if something is holding up your submission, that's like documentation that's been requested, please don't let that stop you from submitting. Probably best to call out that is being sourced, and, you know, submit the rest of your application in anyway. So that way there is a process for us to seek clarification or additional information after your submission is received in relation to those things. Obviously, depending on the magnitude of what's missing, it shouldn't be an issue if it's a minor sort of, proof of certificate or whatnot. That's all from procurement.
And Jason, just to clarify, thank you. And for Jason to clarify, the SEMPHN tender opportunity closes on the 6th of May at 3 p.m. or 1500 hours. So please don't miss those very particular closing times. They're usually structured to make sure that there is someone there to check and be available, which is why we don't tend to do midnight, because we often receive phone calls at the 11th hour. So that's why it's very, very good to observe those closing times. Can I just double check? We're actually past our end date. Is there anything further from the team or for Anne-Marie that you would like to add? Look, I'd really like to thank Anne-Marie for joining us under very creative circumstances. Thank you so much for making yourself available by phone, and we do appreciate that sometimes there is some technical issues. Also, thank you very much to the project team that has supported the bringing together of this tender briefing and the program rolling out. Particularly to Shamila, who has held it all together for us this evening, and to Jason for speaking, and also Sarah O'Leary from Northwest Melbourne. I'll leave you all. Have a very good evening, and we look forward to seeing lots of wonderful applications in our tender inboxes. Thank you very much, everyone. Please remember to use the emails prescribed through the tender services, either through eProcure or through TenderLink or SEMPHN's portal to ask any further questions whilst we're in a live tender environment. Thank you very much.
Thank you.
Bye. Thank you.